when you increase the fluence, sometimes we use 40, 50, but maybe some for actinic keratosis, but most of the time you no need, okay? But you just give the fan to the patient and they set on easy, but really no need.
I don't know if you can see how it is working. I can do this way so it's better to see.
So this is completely portable.
So, and how I normally we use this, of course, with the indication. I have another indication. I've been doing a lot of stem cell, you can say microfat, millifat, and nanofat treatment. We set up a protocol with pre-treat the skin with a low dose from 12 hours, 24 hours, or a few hours before to create a little subclinical inflammation, because we know stem cell working and activating factor working better in the healing process.
And after that, you apply some drug delivery or cosmetic delivery?
Not really, no. I do. Yes, this is another story. Before surgery, I do it. I wait 12 hours and I do the transplant, the injection of fat. So the stem cell, you know, it's not only stem cells. Stromal vascular fraction will find an environment a little bit affected with a little inflammation, so working better. In using other cosmeceutical like exosome, vegetal, human, or other cosmeceutical project, you use the power of
redness. Really, you know where you are after the session. You see really the different passes you did. Okay, so wrinkle. Okay, because you have two wavelengths. It's interesting. For me, it's a performance to have 1550. Okay. Is a normal, so to be efficient is between 50, most of laser fraction, non-fractional are between 50, 40 to 56, 70, but really 1550 was discovered by Tankovic, Nikolai, and it's a very well-known wavelength, and it's interesting to have the thulium in the same. Most of the time you have to take two handpieces, but for this device you have the both. If you want, you can mix or not, and you can really modulate the fluence.
Because if I want, I can take out, or if it's painful, I can change. Another very important thing is to veiculate substances like thulium. It's well known now.
Why to associate in the mix? Do you have any interest to mix both? Because some
because we found a new indication. We found having you can change the hand and do the same thing here. We do a clinical study with histological study, where we found the first erbium is deep, 300 micron, thulium 200, but together they reach more than 1 millimeters. And this justifies the better result we have in the very beginning. We was not justified only for a single wavelength.
50-15, sometimes you can reach depths 1.2 millimeters, sometimes with high fluence, you know, because 20 is not enough, you know, and you can evaluate the thickness of the skin, the scar. You know that for scar after surgery, it's unnecessary to go too deep, okay? But you cannot really, some scars are very difficult to treat, like keloid, so be aware when you have a keloid on 5 millimeters thickness, it's more difficult to treat just with a laser, so you need to combine, but really it's very helpful and for any phototype, so really it's interesting for daily practice. Yes, we are on a battery. You cannot treat 20 patients a day, full face with this device. You need maybe to buy a second battery. But really for a plastic surgeon, for
4 hours. 4 hours.
Yeah, but you know, in Italy we work 12 hours a day. Okay, so we need more battery than you.
Yes,
now.
Of course.
Now it's a joke, but really it's interesting. You know, and in my practice, I have young practitioner, and sometimes my young collaborator takes the devices and put in the pockets, and they leave, and they come back at the end of the day and say, "It was super," because you know you can stay in your in your room where you do consultation. It's not unnecessary to go to a specific dedicated room, because even you take care of the eyes, but you ask your patient to close your eyes, because but you are protected by the tips. Okay, it's very interesting. Even you have to take care because it's laser. It's a diode laser with a double wavelength. So small winkle. It's interesting. Yes, we have any question?
I have a question. Yes.
Yes, for sure.
How many shots does the one tip have?
1 million.
One million.
Shots.
1 million.
So one tip is one patient?
No,
For
no,
one patient?
no. We calculate
40.
patients. Yeah. Anyway, you calculate if you do a face from 20 to 30. If you do a face and neck, depending how many passes, is from you reach 60 or 80 if you do the maximum.
Yes, but you can clean like a tips for a
Yes, of
laser.
course.
Okay, and you can remove the roller. And it's very important. Inside you have a small glasses, it look like a dichroic glasses. You need to clean. It's very easy, but you have to take care. You have to check if as any laser. We don't change the handpiece of our laser CO2. We don't change the handpiece of Pico or many other laser. But you have to take care. But the tips, if you want to change the tips, you can. Okay, you can. If a patient want to come again, she can have, if she want, own tips. On maybe if you want to share the device with your colleague, because you find that it's unnecessary to have just for you. What you do, you buy the device,
Yeah.
and you have your own handpiece. If you use your handpiece more than your colleague, he pay for his own handpiece, you pay for your own handpiece. So you can share. It's very easy. It's very comfortable.
And
for
you
some
know
patients.
exactly how many times you use a laser, because
Yes,
the counter.
15.4 percentage of the use.
Yeah.
You know, so you have always some information about your device. You have a counter, so it's interesting. When you want to make a full face, it needs maybe 50,000 shot. Really, it's interesting. You can calculate, and to be reproducible for the next session, you can say how you estimate with how many shots you need.
Of course.
Any questions from the floor?
Yes.
For scans. How many shots?
Questions from the floor?
It's on the scan.
Seems everything is clear.
Yes, it's interesting, Giovanni. You are plastic surgeon, Teresa, you are derm. You have the perfect combination, the same as me. Okay.
Yeah, but you too. So.
But really,
you are the combination already.
Yes, I'm very helpful. I encourage, for them, it's very common. But to have this portable device to change your clinic, maybe Teresa, she has a 100 clinic in, okay? So yes, but for plastic surgeon, it's very interesting.
Yeah, really. And you can treat scars.
Yes,
the scars, as soon
fresh
as you
scar.
have
Fresh scar.
Normally, we're not able to do it with.
And you have a
Use
lot
it
of
on the
treatment.
upper eyelid?
Yes, you can do it also eyelids. Of course, it's a non-ablative. You know, the
No,
golden
the
standard.
depth is around 1.2 millimeters maximum.
show you.
So be aware. If you want to treat eyelid, if you are in contact with the body, it's okay.
Can you
But-
apply anything after?
But stay on the bone, no more.
What
Or
if there's
put
a
glove.
question
Or put
from
glove.
the floor? There's a question here.
Yes.
Do you apply any thing after, like exosomes or
Yes.
any kind of product?
Yes, skin booster, whatever you want, because you can estimate to reduce inflammation or redness. It depends where you are, in which country. Availability. Yes, you can do. Some colleagues do some session with a photo biomodulation just after with a red light, if you want. But as a first target is laser. It's laser first, For my part, I don't use exosome. Sorry for that to say that, but I prefer to use skin booster. Sometimes I put patient under LEDs, redness for 15 minutes to reduce redness and pain. But even is it painful?
It's painful.
It's okay.
It's okay.
If you have.
Can you treat hand, neck,
course. Yeah.
full body maybe?
Yeah.
Full body.
Yeah.
Okay.
Of course, with different
Not sure.
power. Of course.
Okay.
If
I repeat, the line is maximum is 14 millimeters.
Yes.
So for scar, you need to adapt the distance.
Yes.
So if you have
So,
a small scar,
scar,
8 to
Look, here, distance, big scar, small scar, until 2 millimeters.
spacing. Can you,
Sorry,
so
yes, so
spacing is
spacing,
maximum
2 millimeters.
and minimum is 0.5.
0.5.
So be
0.5.
aware. You can use it, okay, but the risk, really to be comfortable, sometimes you can induce some just blister with
Yes.
any
You will.
laser. But really to induce scar is impossible. Really,
No,
it's
no.
impossible. No need.
And this is really, we say, the revolution as we have from the big computer to the iPhone. And I think in the future we have more and more portable device, pocketable device. And another thing is what's happened when a laser in the morning, you have the full agenda full of patient, your assistant switch on the laser doesn't go. It's a nightmare. And the nightmare starts when the assistant says, okay, we'll send the technician in 2 days. And after, all is abroad. This is very solid. I think the only problem is go down,
Yeah.
but this is only for your glass. Yeah?
Yes.
Yeah. And must be careful. But you can have also a little strip to put here. And the assistance here is in France, because they produce in France. It's an American pattern, Russian America, because the inventor is Russian. Now it's 100% American, and he patented in the US, and he patented all around the world, also in China. But the producing is here in Clermont-Ferrand. So from here or any part of the world, there is many distributor. You can send DHL to the laser, and you will be back another one. It's not possible to open and to repair, except from professionals. But in the meantime, you will have, and this is not possible with a big machine. They cannot send you in.
And the most
in a pocket.
interesting about the power,
The
until
power.
50 millijoule.
It's a lot.
You can compare with a lot of big devices we have on market, exactly the same. And Nikolai Tankovic estimates that it's unnecessary, but I know that if you want, you
On
can
scars.
ask for
On scars,
70 millijoule. But really, what for? I use since now 2 years, and I will believe that it's unnecessary. About scar, you need sometimes more between 3 to 5. But it depends. It's a new scar, fresh scar, or old one. Okay, for acne scar. For acne, active acne, we don't wait. It's very comfortable for young patients. You can use really. Be aware if your patients are under isotretinoin, but it's not forbidden today.
Yeah.
We know that you can use it. Depends which quantity of drug you take, but you can. It's unnecessary to wait the end of the treatment of acne. Active acne works. You don't have any flare-up, and it's very interesting for young derms. They don't want to invest in a big devices. Sometimes it's too expensive to have a big platform. So that even for derm, you have many indications.
You have 1 minute to wrap up.